Welcome to our In Focus discussion tonight on Breast Cancer Awareness Month. According to the Utah Department of Health, breast cancer is the most commonly occurring cancer in the U.S. and the leading cause of female cancer-related deaths in Utah. Tonight we discuss the warning signs, risk factors, and impacts of breast cancer, as well as why one particular ethnic group is most vulnerable for this disease. Joining us tonight is Shehenor Garewal, who is a breast cancer patient. And so, Shehenor, thank you so much for making time to be here tonight. It's great to have you.
Thank you for having me.
Shehenor, can you tell us a little bit about yourself?
Yeah, I am now I'm a breast cancer survivor. That's a term used for anyone who is surviving breast cancer. I grew up in Utah, and my parents are Indian immigrants. Technically, I'm an immigrant too. I was born in Canada, and essentially I call myself a Utah native. I went to the U, very much a Ute.
Go Utes.
Exactly. And I got my law degree here, my master's, bachelor's as well, and then I moved to Florida for the last 6 years, but have been back for cancer treatment in the last 6 months.
Yeah, thank you so much for just letting us get to know you a little bit. At your own comfort level, could you share what led up to your breast cancer diagnosis, or maybe what was it that made you first think that something could possibly be wrong?
Yeah, so my underlying breast cancer is called inflammatory breast cancer. It's a really rare type of cancer. About 5% of all breast cancer patients deal with it. Instead of a typical bump or lump that you might feel in your breast starts swelling and feeling very painful.
So it did hurt.
It did hurt. That's not very common for all types of breast cancer. For mine, it is. People get misdiagnosed consistently because they think it's a milk duct infection because of the way that it acts. In my case, I thought it was a hematoma, so that somehow I might have just gotten hit in my breast and that there was blood pooling underneath. So it was a bit of a surprise when I went to my primary care physician, and he said, "I think you have carcinoma. Let's get a mammogram ultrasound done just to double check." With me, there was a little bit of skin thickening on the left side of my breast, so it felt very firm, which is typical for inflammatory breast cancer. The breast skin also started looking a bit like an orange peel. It's called orange peel skin, also very common. And that was basically my first instance of realizing that I have breast cancer at the age of 30.
So how long ago was that? So you said you got diagnosed at age 30. How long ago was that?
So the breast started swelling and feeling swollen mid-April, and within 2 to 3 weeks I went to my primary care physician when I realized it wasn't getting better. By, I believe it was May 13th, I got the diagnosis for breast cancer.
How has your treatment journey been since then?
It has been fascinating, I guess is perhaps the best word. I realized when I had breast cancer living in Florida for the past couple of years that I wanted to come home with my family. My parents live here. Again, I grew up here, and I know the Huntsman is a wonderful cancer institute. So,
and it helps to have family with you there for the emotional and mental support. I think that's an important part of it.
Absolutely, and beyond just my parents, I have neighbors who have taken care of me the entire time. Every time I have chemotherapy every 3 weeks, they spend several days buying me food, just making sure that our family doesn't have to worry about food while I'm feeling tired and exhausted after chemo. My friends have come from all over the country to come visit me during this process, so I've been really lucky that my cancer experience is much more, I guess you can say, comfortable than other people's because I have such a wide support system. I also have my little dog, and she's been the best. If you don't have a dog, definitely get one.
Dogs are the
Yes.
best.
She snuggles up with me consistently, especially after a down day from any of the side effects. She knows, and so she's been around as well.
Good. I'm so glad to hear you have a good support system. Now, Shehenor, you have been diagnosed with stage 4, which is also known as metastatic breast cancer. So what have you learned about the disease at this point, and what do you want the public to know about it?
So after the inflammatory breast cancer, we did a PET scan, and that's when we found out that breast cancer had metastasized. So with breast stage 4, sadly it's not curable at the moment. It is treatable. It is a really dismal prognosis. So the average person who has breast cancer has about 2 to 3 years is the average diagnosis to live going forward. No more than 25% of men and women, because it is both. We only discuss breast cancer in women. Men do get it as well. 25% don't make it after about 5 years from their initial diagnosis. There are some amazing stories of people making it 20 plus years, but the reality is I'm dealing with a disease that is incurable and can turn terminal, meaning there's no further treatment really at any juncture in my life. Hopefully that's not the case anytime soon, but it's a reality that I'm facing.
And another part of it too is what you've told me is that oftentimes patients don't look sick. Like I look at you, and if I didn't know your story, I wouldn't know that you were sick, right?
Yeah, chemotherapy is the biggest reason I've been having a little bit of brain fogginess. It's called chemo brain. So if you see me kind of grasp for words, that's a reality I'm facing right now. This is actually a wig. I am very bald underneath there. I have.
You rock both very well.
Thank you very much.
Just because you're so beautiful.
Thank you. I have about 5 eyelashes left, so I'm hanging on to them as much as I can. You know, the physical part is because of chemotherapy. The average person with stage 4 breast cancer is very lucky that if they had chemotherapy or anything, that's a short-term treatment. After that, the other drugs and anything else that's used generally doesn't make you bald, and so people look fairly healthy, even though internally, you know, mental health-wise, everything, all of a sudden you're grappling with the reality that you might not live forever.
And Shahanur, we have about 30 seconds left. I want to give you the last word. What's your takeaway message that you want to send to our viewers tonight?
We need to fund stage 4 breast cancer. That's a reality. It's the only type of breast cancer that kills, and there's not enough funding. There's less than 5% of all funding. So what we need to do is look at organizations like Medivivor and the like, and start funding breast cancer so that no one else has to die from this going forward.
Yeah, and you know, you are such a strong woman, and if anyone's going to beat the odds, I know it's going to be you, and we're cheering for you.
Thank you so much, Rosie.
You've been hearing from Shahanur Gurewal, who is a breast cancer patient. And Shahanur, thank you so much for being here with us tonight. You're incredible.
Thank you so much, Rosie.
We'll be right back. Thanks for staying with us for our second In Focus discussion tonight on Breast Cancer Awareness Month. Up next in our conversation is Dr. Richard Ferguson, President of Black Physicians of Utah, and Dr. Geeta Suneja, Associate Professor of Radiation Oncology for the Huntsman Cancer Institute at the University of Utah. Thank you both for being here tonight. We will start our conversation tonight with Dr. Suneja. Dr. Suneja, when should someone get screened for breast cancer?
That's a great question, Rosie. There are a lot of different guidelines out there which can be confusing to interpret for those who are interested in getting screening. Ultimately, it's a conversation that should be had with a person's primary care provider because they can assess each individual's risk for developing cancer. But at the Huntsman Cancer Institute, we follow the National Comprehensive Cancer Network guidelines, which recommend screening starting at age 40 with an annual mammogram and also an annual clinical breast exam.
So it's definitely a conversation that everyone should have with their primary physician and just keep right in the conversation.
Yeah, screening saves lives. Mammograms reduce the risk of cancer and also help detect cancer at an earlier stage so that the treatment is less invasive and more effective.
And Dr. Ferguson, if someone finds a lump, what should they do?
Well, I think the first thing is not to panic. Lumps occur, especially when women are menstrual age, and so it can be due to something other than breast cancer. I think we have to consider fibrocystic disease, fatty necrosis, sometimes having a large macrocyst or a cyst within the breast. So the thing is, doing a self-breast exam, go in, monitor it at least for several days or during one's menstrual cycle, because it can change during that, and then seek out primary care. They will be able to determine, all right, now I'm more concerned for cancer, and then that's when we do the risk stratifying. Do you have a family history? What's your age? Which we can get into later.
Yeah, I absolutely agree with that. And I think the other thing about Shahanur's story that she shared is that it really shows the importance of going in for evaluation when you do have symptoms. So that includes a lump, but also any other concerning findings like skin changes on the breast, it's important to have those evaluated by a medical professional.
And I think it's important to note that, don't always correlate a lump, right, with automatic breast cancer, because that's sort of the top message that we've been hearing about breast cancer. And so, Dr. Ferguson, I'm glad that you reminded all of us, like, don't panic. It could mean a variety of things. And Dr. Suneja, I think you bring up a good point that, we hear that 40 is typically the golden age, but that doesn't mean, like, discount the symptoms that you might be experiencing and not getting, right, those scans or those tests. Dr. Suneja, who is at a higher than average risk for breast cancer?
So there are some risk factors for developing cancer. So most women develop cancer randomly. So we spend a lot of time focusing on risk factors, but most breast cancer is actually random, or what we call sporadic. But there are some things that can increase our risk. So for example, people out there may have heard of BRCA or other genetic mutations that put a person at higher risk of developing breast cancer. So that's something that's especially important if there's a strong family history of cancers, either of the breast or other organs in the body. And other things like exposure to estrogen, so hormone replacement therapy, even obesity can lead to more estrogen in the body, which can increase the risk of developing breast cancer.
That's so fascinating. Dr. Ferguson, I wonder if there's any other risk factors, maybe you can chime in for breast cancer. So we talked about BRCA, right? What else are there?
So, of course, having it as what BRCA, and then particularly hormone positive breast cancer. So if that's in a first generation family or first degree family member, so sister, mom, even sometimes a grandmother, that can put one at increased risk. Also, when someone is particularly having a child later in age, also puts them at increased risk, and a increased body mass index. So being obese or overweight and gaining weight increases one risk for developing breast cancer.
All things to look out for. Dr. Ferguson, where does breast cancer rank when it comes to the deadliest cancers in the world?
So it actually has surpassed lung cancer. As of WHO this year, it's #1 in the world for #1 diagnosed cancer worldwide. So I think part of that has been skewed some due to smoking campaigns, people having to cessation and smoking more, but also how it is being diagnosed. So you have more people that are sometimes are actually getting screened up slightly a bit more now, but also the pandemic has shifted things where not necessarily more screening has been occurring worldwide, but actually less. And so now there's later presentation of breast cancer.
And I'm glad you're bringing up the COVID-19 pandemic. We'll put a pin in our conversation right there and pick it up on COVID when we come back. So Dr. Ferguson and Dr. Suneja, hold that thought. We have to take a quick break. But when we return, we'll resume our In Focus discussion on Breast Cancer Awareness Month. Welcome to our third and final In Focus discussion tonight on Breast Cancer Awareness Month. We resume our conversation now with Dr. Richard Ferguson, President of Black Physicians of Utah, and Dr. Geeta Suneja, Associate Professor of Radiation Oncology for the Huntsman Cancer Institute at the University of Utah. And Dr. Suneja, we'll start with you again. How has the COVID-19 pandemic impacted breast cancer prevention efforts?
So unfortunately, COVID-19 has had a really profound impact on really all types of cancer screening, because for the months that many of our institutions were really restricting the number of people coming through, cancer screenings really declined. And that was felt necessary at the time to contain the infection, but it's actually led to more people coming in now with advanced stages of cancer. So it's very critical as we emerge from the pandemic or learn to live with the pandemic that people resume their normal cancer screenings.
That's just so devastating to hear how COVID-19 impacted people who was not directly impacted by the virus, but maybe had other underlying illnesses or other chronic diseases and were impacted because of the restrictions on treatment or the screenings. Dr. Ferguson, Black women have the highest mortality rate in the U.S. for breast cancer. Why does this disease disproportionately impact this demographic?
Well, I'm glad you asked that question, Rosie. And a lot of it is actually not that there's a significant genetic predisposition to Black women or certain groups of women of color being predisposed to developing breast cancer, it often has a lot to do with the social determinants of health. So often low income, possibly not having insurance, because I think it's been well documented, at least from a study in 2018, that in that 2-year period, 2016 to 2018, 39% of people that were uninsured received mammograms, as opposed to 75% that were insured. So as the Chief Medical Officer also for Health Choice Utah, a lot of my efforts here in the state is actually to encourage women that are part of my Medicare and Medicaid plan to go out, seek your PCP, and get that appointment scheduled. But what I really want to point out is the incidence is actually higher. So being diagnosed is higher in non-Caucasian or in whites or as opposed to Black Americans. And the bigger difference is increased access to care, more likely to be diagnosed earlier for treatment. Mortality is higher because often when a Black woman is diagnosed, she's later and has an advanced stage. And there are several factors that often create a barrier for her getting increased access to, one, getting the mammogram, or actually getting treatment and getting the appropriate treatment.
And something that I've noticed in many communities of color, including my own family, is this mentality of, I'm okay, you know, my body is just tired. Like, it's almost like denial of what you're going through. And sometimes people wait until the symptoms get really, really bad to go seek treatment. And sometimes there's a mistrust, right, between Western medicine as well as other cultures as well. And so as you're talking about some of these things, Dr. Ferguson, this is what's coming to my mind as well. Dr. Sanasia, Dr. Ferguson, right, talked about how Black women, right, are the top ethnic group to be diagnosed with breast cancer. What are some barriers maybe to breast cancer screening and prevention in the Black community?
Yeah, that's a great question. So there are multiple barriers. It's multifactorial, actually. So there are some social barriers, economic barriers, and some behavioral challenges that are face women who come in for screening and treatment. So you mentioned a really important one just now, which is stigma. There's been a lot of work done to raise awareness of breast cancer. It's October, it's Breast Cancer Awareness Month. There's so many places and companies that turn everything pink this month. And awareness is critical and super important, and so is action. So it's really important that people are aware of what some of these barriers are. It can be costly to undergo screening and treatment. I think one important message is that the Affordable Care Act mandated that all insurance plans cover breast cancer screenings. So sometimes there's a lack of awareness or concern for the cost. There's stigma, there's fear of getting diagnosed with a cancer, which brings a lot of unknown. And there's, you know, lack of familiarity with what needs to be done for personal care and self-health.
And I think also to add on to that, there's sometimes a culture and language barrier, as you were alluding to, Rosie. And one of the most rapidly growing parts of the Black community within Utah is actually immigrant and refugee. And so when from their current countries, it's often they might not have ever received a mammogram. And also discussing cancer also sometimes brings it to life. So thus they don't want to go and get screened because it may say, oh, you're more likely to be diagnosed. So it's trying to discourage some of these myths and encourage people to increase more trust in seeking health within the healthcare system.
So Dr. Ferguson, what can people do right now to get screened for breast cancer? And tell us what mammogram screening is and why it's important.
I think the first thing is if you have a PCP, go out right now, or excuse me, not go out, but call them, try and schedule as soon as you can to get in. Because women are often the caretakers of families, and they're putting child care, elder care above themselves and not really making, honoring themselves by pushing for self-care. This is that time that I want to encourage you. Often, your PCP is at first. You can even go to an urgent care. They're going to discourage you from doing that, but they can order it, especially if work is an issue and that is the closest medical facility near you. They will order it.
Yeah, I love that we're talking about cultural and gender norms in this conversation as well. And Dr. Sanasia, I want to talk about treatability. How treatable is breast cancer? And do the factors vary? What do we know about treatability?
That's a great question, Rosie, and we've been talking a lot about some of the challenges we face with diagnosing and treating, especially certain types of people, Black women who face disproportionate barriers. But there's also a lot of good news, which is that breast cancer mortality has decreased by 40% in the last 30 years. And that's because of increased awareness, screening, early detection, and the really amazing progress we've made in all the different treatments that we have available for breast cancer. So it is treatable. Detecting it at an early stage is critical. That's why we really emphasize the importance of screening. But breast cancer, even stage 4 breast cancer, is highly treatable. And so I would encourage anyone out there who has concerns or questions to investigate and come in for a visit to make sure that they know how best to advocate for themselves and their family members.
Right, the takeaway I'm getting from all this is early screening. Like, don't wait to get screened and tested. Dr. Ferguson, we have about 30 seconds left. I'm going to give the last word to you. What's the takeaway that you want our viewers to get from this conversation tonight?
I would say that not all of this needs to fall on women to go and seek care. Everybody, every man that's listening to this program has a mom, has a sister, has a daughter, has a grandmother. If you care and you love them, ask them, when's the last time you got your mammogram? Because if you're over 40, you should be getting it every year, especially if you're insured. And if not, seek a way to help them to get insured so they can get access, or help them to pay to get a mammogram. It can save their lives.
Well said. You've been hearing from Dr. Richard Ferguson, President of Black Physicians of Utah, and Dr. Geeta Suneja, Associate Professor of Radiation Oncology for the Huntsman Cancer Institute at the University of Utah. Thank you both so much for your insight and medical experience tonight.